about the NHS Clinical Entrepreneur Programme, which is going to be coming this year to Northern Ireland for a second time. You're all very welcome. Please be aware that this event is recorded, so you can access a recording of all the presentations and information at the end of after the event. There will be a question and answer session at the end of the event. However, due to the large number expected to attend, we will simply be managing that in the chat. Next slide. Just to run through briefly our agenda, we'll be starting with a welcome and introduction from the Chief Executive of the Health Innovation Research Alliance in Northern Ireland, Joanne Rhodes. This will be followed by a brief discussion and presentation from Professor Yes, Professor Tony Young will then follow with his discussion. He is the National Clinical Lead for Innovation, NHS England. This is followed and welcome to Professor Ian Young, Chief Scientific Advisor, Department of Health in Northern Ireland, who will deliver a presentation on research and innovation within our NHS here, which is called the Health and Social Care Service. And then I'm delighted to welcome Dr. Francis Duffy, who is a consultant clinical psychologist, and Sinead Welsh, a social worker and child protection specialist, who are both at Northern Ireland NHS clinical entrepreneurs for this year's cohort, and they will be able to share with you their experience of this year's programme. And this is followed by a brief information on support from Invest in I and the application process itself, followed by Q&As. So without further ado, I'm going to hand over to Joanne Rhodes. Thanks, Joanne.
Thanks, Siobhan. Hopefully everyone can hear me. I'm just waiting to change slides. I don't know, Erin, can you give me control? Hopefully that's me now. Hopefully I can move to the next slide. Let's see. Oh. Sorry, apologies. I can't move it, Erin. You might have to do it. It's not working. Okay, so brilliant. Really delighted to welcome you today. So I'm Joanne Rhodes. I'm the Chief Executive of Harani Health Innovation Research Alliance Northern Ireland. And we are delighted to bring the Clinical Entrepreneurs Programme to Northern Ireland for the second year this year. Next slide, please. So we're just a not-for-profit alliance of the two universities here, Ulster and Queen's, healthcare providers and institutions, and the life sciences and health sciences industry here. And we aim to unlock growth and collaboration for both health and wealth in Northern Ireland for all of our citizens and businesses. And we're delighted to facilitate the Clinical Entrepreneurs Programme this year. Next slide, please. So just, I'm sure you all know, hopefully all the people who've joined are from Northern Ireland. So this is maybe for Professor Tony Young's benefit. But anyway, so as you know, we've got two universities, a huge number of life science graduates and researchers here, and 5 trusts. And in fact, I think we've got one of the largest or second largest trusts in the UK here. With 80,000 staff working across health and social care. If you add the life sciences industry onto that, it's about 100,000 people. We're only 1.9 million people, so actually it's about 8% of our working population really understand health and life sciences. So I think that's absolutely phenomenal. We've got an SME industry-driven ecosystem with about 300 life sciences firms, but we've also got a very vibrant engineering, technology and digital sector here. It really helps to feed into the transformation that's going to need to occur in health, and that we've already seen occurring up to now and then over the pandemic, and we'll see very rapidly in the future. Next slide, please. So Harani works across sort of the four axes. So there's academia, busy doing some of the research along with clinical colleagues as well. We help manage industry collaborations, but also linking through for spin outs into industry to help them get investment, understand their assets and technology, recruit talent, etc., and really bridge that entrepreneurial ecosystem. Critically, you'll see I've ringed clinical, because for me, in order to improve health outcomes and wealth outcomes, we need to adopt innovation, which occurs throughout the health service, and support framing those relevant challenges in order to think about how to transform and how to make things better, and really also help support the workforce to do things more efficiently, and develop those critical ideas that will actually inform new working practices and patient outcomes. And we also work with the government as well and think about the infrastructure that might be needed to support the health and life sciences ecosystem, what skills might be needed in the future, and how that can impact economic growth. And so on the left, you'll see we've got binoculars, and we're the eyes, we're the ears, but really what we do is try and just connect information and frame the problem, but we also have unique audiences as well. So we have the audiences of all these different facets to try and bring the information together, amplify knowledge, and exchange skills there. But for me, it's the clinical piece that's absolutely critical in order to understand what's happening. And so the Clinical Entrepreneur Programme is fantastic at being able to help frame those challenges. Next slide, please. So this is a bit of a no-brainer question. Why is innovation important in health? But as you know, you're doing it all of the time with whatever you decide to adopt, and it's important to improve patient safety. But actually, in order to be able to develop that in a more cohesive way, to be able to share that amongst yourself and really think how you could scale it. So really, innovation is actually the adoption of these things and these ideas into practice. And the health services and the employees within are closest to be able to understand what is the real challenge and how are we going to solve this and work together. Next slide, please. So I'm just going to talk you through a few of the barriers preventing innovation from moving forward, which you'll all be aware of, but I just wanted to frame them here. So health is complicated. It's hugely complicated, and obviously patient safety is at the heart of that. So it needs a huge amount of work and a huge amount of understanding to be able to think about how things can change in a meaningful way. Next slide, please. There's the priority of demands, which I'm sure you're all feeling now as you've tried to join this meeting. You've got this high demand for frontline services, there's reduced priorities, you've got reduced resources, focusing on the near-term problem rather than thinking about how we might juggle things and adopt long-term innovation to actually solve those challenges. And it's a huge barrier to be able to think about how to do things differently. Next slide, please. And then to people who understand the problems, where are the entrepreneurial skills and connections? And I think I've been really astounded by the first year of the Clinical Entrepreneur Programme, and we'll hear from some of our clinical entrepreneurs a bit later about what it means to understand how to do things, what skills you would need to move your idea forward, what value a short conversation with a new connection can bring to help you understand how to move that forward. And these really aren't readily available within the health service in Northern Ireland. And so Harani helped in our attempt to try and help connect that to the wider network and to bring that to you. The Clinical Entrepreneur Programme absolutely delivers for us. And as I said, we'll hear what it's done already in the first 6 months. Next slide, please. And again, so just the tip of the iceberg is really the thing that clinches it for me is this push versus pull innovation in health. So often what's happened previously is you might get a company contact you who have gone through an R&D process on the technology push. They've done a huge amount of production. They've spoken to a few customers, we think, and they've really undertaken their marketing machine. But actually, what need are they trying to fix? And there's lots of things that purport to change health or to help people, empower them with their health. There's the Apple Watch, there's the Fitbit, there's Babylon Health and other things. And these have struggled to become adopted, and there's a really long birthing process for them to become adopted into the healthcare process. And often there's a lot of challenges because they haven't necessarily had the need in mind. However, if you think about a pull innovation, this is where the expressed market need along the bottom from clinicians, from patients, from healthcare institutions is expressed and then actually feeds into the research and development. That production is an iterative process, and then you get the marketing that moves that forward into adoption. And I would hope that would be a faster process. And we have a great example here in Northern Ireland of Elemental, which is a social prescribing platform that came from a group of innovators who really understood the social prescribing piece and actually developed their sorry, my daughter's just screamed, but it's a spider. Apologies, she's completely put me off. So Elemental has really developed their social prescribing software, but they came from a position where they really understood the problem and they were working closely as social workers through and developed that market need. And they rapidly developed that and now scale across the whole of the UK and into Ireland as well. And that's a phenomenal team that scaled really quickly. Next slide, please. So I won't go through this because I know Professor Tony Young is going to talk us through the Clinical Entrepreneur Programme, but we're really delighted that they've agreed to let us in for another year from the Angela Ruskin University team and the Accelerated Access Collaborative. And I'll let Tony introduce that, but really absolutely delighted that we can join this year. Next slide. And I think I've spoken through a fair amount of this piece around the opportunity here in Northern Ireland, but really wanted to finish on Mark McCary, who's the acting chief executive of the Northern Ireland Medical and Dental Training Agency, who said, when I meet with staff across health and social care, I'm continually impressed with the innovative ideas that they have to improve patient care. The introduction of the Clinical Entrepreneurs Programme provides the potential for such thinking to gain further traction within the service through direct support, development and investment. And I couldn't agree more. And I hope when you hear from Sinead and Francis, you'll begin to hear already some of the benefits that they've seen from the Clinical Entrepreneur Programme. Next slide, please. So this was introduced in 2022 in March, and we had 7 clinical entrepreneurs from Northern Ireland who were taking part, and already it's been hugely successful. And we couldn't have had a wider variety of medical and healthcare backgrounds, from dentistry to social work, GPs, nurses, and specialty care consultants and paediatricians. So it's really shown us the breadth. And there's our beautiful cohort of clinical entrepreneurs here that have then joined the 100 or so clinical entrepreneurs across the rest of the UK to share their ideas and share their vibrant enthusiasm for solving some of the hardest challenges within health and supporting each other. So really, here are some of their quotes here that they've talked about. So the NHS CEP programme has really helped them on their journey to secure funding. And so we've got examples of funding already and grant funding to develop those groups through Innovate UK and NIHR grants that have been bid for. The networking connection has been absolutely fundamental to move businesses forward, and we'll hear a little bit from Sinead about that later. Already we're seeing some economic benefits for Northern Ireland as those platforms are being rolled out for students, and I'll let Sinead talk about that as well. Students and to assist with mental health, and also with the dementia patients. And really, it gives us a deeper insight of the digital healthcare sector and how experienced healthcare professionals can actually engage with those different skills to really think about how their innovation can benefit their patients. So next slide, please. And I'll hand back to Siobhan. Thank you.
Hi, I'd like now to introduce you to Professor Tony Young, who's the National Clinical Lead for Innovation for NHS England. Welcome, Tony, and I'll hand over to you.
Thanks so much. And I'm assuming you can hear me all well. And I'm also going to introduce my co-clinical lead on the Clinical Entrepreneur Programme, Tamsin Holland-Brown. Do you want to wave, Tamsin? I can see you. Yeah, there she is. Right, and I'll get her to come in and give you a couple of views. That is a very old photo. I have had a haircut since then. I need to have another one though, I think. And it was lockdown I blame, but that was before lockdown, so I can't really blame them. So look, welcome to this webinar telling you a bit about the Entrepreneur Programme. So I'm Tony Young. I am a consultant neurological surgeon at Southend Hospital, Associate Medical Director across Mid and South Essex. So we look after a population of around 1.2 million and have a turnover in our ICS of around 2-point-something billion or so. And responsible for innovation and transformation there, the Chair and Director of Innovation and Entrepreneurship at Anglia Ruskin University, who are the hosts for the Clinical Entrepreneur Programme. A lapsed entrepreneur. When I was a junior doctor, 4 startups, raised 5 million and exited them all. Some were huge successes and some were just the most awful failures. I'm still scarred by the experience now, but I learnt a lot and I kept going. And then 8 years ago, I started at NHS England as the National Clinical Director or National Clinical Lead for Innovation. So a clinician who'd been put in a leadership role for a whole nation's healthcare innovation. That's in something called the Innovation Research and Life Science team, but I'm also part of something called the Accelerated Access Collaborative. So how we get the latest, greatest things taken up from a government and policy perspective. And, you know, it was junior doctors 6-7 years ago now that approached me when I was new in post saying, come on, you've done it. You've done a startup alongside your PhD, alongside your surgical training, and you've succeeded. And now you're the national director and we're raising money for startups and we're being told to quit. And I went to see Bruce Kerr, the national medical director, who just said, these are some of our brightest, most intelligent people that we're losing. Well, we support people who want to be academics and clinicians and leaders and clinicians. Why can't we support our trainees that want to be entrepreneurs and clinicians? But it wasn't just trainees, it was fully trained doctors, it was dentists, it was nurses, it was allied health practitioners, it was pharmacists, it was clinical scientists. In fact, all people who wanted to work in the NHS. And we were missing a trick because we were, you know, the startup world is changing so much of our life, isn't it? You know, so many things we use and everything have come through that process. And the startup is just an experimental methodology for saying, have I got something that works and can I scale it? A clinical trial in medicine is, have I got an idea that works and can I scale it? So the startup is to the commercial world as the clinical trial is to the medical world, and we weren't using that. So long story short, 6 years ago, we founded this program. Now, I am going to keep us to time and I want you to hear from other people too. And I'm staying around for question and answers at the end. But the core thing of the program and what it offers you are a commercial mentor. This could be someone from the public sector, the private sector. We have international, global stature mentors from tech giants like Microsoft and Amazon, the big medical technology companies, big pharma companies, but also large healthcare providers in this country and internationally as well. Over 250 of them now. But also a whole range of educational and networking opportunities. And if you're in training in England, what we do is we can help support you to apply for less than full-time training. I'll write you a letter and approach your training authority. Now in Northern Ireland, people have been really accommodating and flexible about that, but we can't just say you're going to go part-time or this or that's going to happen. It's about winning hearts and minds. It's about talking to your employers or your training provider and working out what the right and sensible way forward is. We also arrange access to customers and funding. We have 10 what we call insights now up and down the country, innovation sites, which will help you explore your innovation. Access to funding, we don't give you any money, we don't pay you for this. To come on this, it's not a paid fellowship. It's kind of 8 to 10 day-and-a-half sessions across the year where you come and touch base with us and then with your mentor outside of that. But that networking with your peers, and I think you're going to hear that from some of your Northern Irish colleagues that are going to give their views. I have no idea what they're going to say, so well, they'll be plain speaking with you, is my experience of my colleagues in Northern Ireland, tell you how they what they really think it is. But what we've uncovered is actually we're just gathering our year 6 data. Over 200, we've had nearly 900 people on the programme now through it. Over 250 of them who'd either quit the National Health Service or were going to quit it to go and try life in the commercial world, in the private sector world, have stayed or returned as a result of this programme. So we've turned a brain drain into a brain gain. I still practice as a clinician, essentially 1 day a week, still operate and do clinics. It's still something I find incredibly fulfilling. But I use my other skills, Micah, to do so many other things in my life. I don't do startups anymore, but I do leadership in all sorts of ways. So I think the programme has given an opportunity for those creative people, those people who really wanted to try and change and improve patient care, beyond that direct person in front of them that they would see as a doctor or a nurse or pharmacist or whoever, to have that wider impact. So look, I'm not going to speak anymore because Tamsin Holland-Brown is my co-clinical lead and she is a paediatrician from Cambridge. So Tamsin, would you just like to share for a moment any reflections you have on the process? Tamsin started as a clinical entrepreneur and I managed to persuade her to come and kind of be our co-clinical lead for the programme. So you get to meet her over the next year. Tamsin, what are your thoughts or reflections that you would share? We just got a few minutes before we hand over.
Well, I was incredibly fortunate to have been on the clinical entrepreneur program myself, and it was something that I just needed that amount of support and that mentorship, and it made a huge difference to what I was able to achieve. And then there's also this amazing opportunity then for Tony to provide leadership opportunities within the program even. And so there's just been what you have is the most extraordinary network of people, and I think that I hadn't been able to think as big or been secure enough to carry on for me if I hadn't been in the program. And for me it is an enormous privilege to be able to support others in some way as this program moves forward. And it's been extraordinary, some of the entrepreneurs we've had from Northern Ireland.
So Tamsin, why don't you tell them a little bit about what your innovation is, because it's quite exciting.
Oh, well, I'm a paediatrician and I work with children with a hearing loss, and I wasn't allowed to use the £3,000 hearing device for my patients. And I was so upset about that I ended up finding a hearing solution that cost under £100 instead. And it's a little hearing device that the child wears like that, and the teacher, and then the child is connected to a teacher's microphone so that they can hear well. And this is, children have a really common type of hearing loss in childhood, which affects 1 in 10 children. And it's even more prevalent in countries without robust healthcare systems. So these are now currently being used in hospitals in Malawi as much as they're being used in hospitals in the UK. And also I have an app as well. So lovely for me to be able to support other people with tech and software.
Well, Tamsin, let me tell you, it's been my privilege to get to know you and to have you join our program and now our leadership team. Look at that, frontline paediatrician who's changing children's lives across the world. It's not planning, and you don't have to want to build the next Tesla or SpaceX. really wanted to improve patient care. But actually, if you don't approach it in a commercial way, you don't always have to approach it. You don't have to have a spin out. You could be a social enterprise, or you could want to be an intrapreneur rather than entrepreneur. That's fine. But actually, if you don't build something, look how excited Tamsin was. She just picked it up and showed you her little gadget that she's got. And it's not going to make that difference to our patients' lives, is it? You've got to build something that's sustainable. No problem with making a profit, because if you don't make a profit, you haven't got a business. And if you haven't got a business, it's not going to sustain. In the NHS in England, I can't buy it if it's not like that. So we were missing that trick, and now we're really supporting it. And can you imagine, Tamsin, as you're going to hear from two more of your colleagues from Northern Ireland. Oh, and the exciting news is not just that the entrepreneur program opens in about a week's time, but I think colleagues are going to be telling you we're coming to Belfast in middle of October. I want to say 14th and 15th. I might have got the date slightly wrong. Someone will correct me. But we've got one of our pit stops there. Go on, Siobhan.
It's the 13th and 14th.
There we are.
Thursday and Friday, 13th and 14th.
13th and 14th. And do you know, I think I've got about 50 of our entrepreneurs from England who are flying over to come and meet you and share. We're going to have a great session. We're covering artificial intelligence. We're covering pitching your ideas. And you're all invited. You want to come and have a taster, see what it's about, meet some of those clinical entrepreneurs. That's going to be happening too. Well, look, I'm at 1:30 now. I've overrun very slightly. I think Tamsin's staying around as well for Q&A. We've got another couple of a few people you're going to hear from now, but I'm going to hand back to Siobhan.
Hi, everyone, and now I would like to introduce Professor Ian Young, who is our Chief Scientific Advisor in the Department of Health Northern Ireland, and I'll hand over to Ian, and I believe Erin is going to share the slides for you, Ian.
Ian, you're on mute. Thank you. Thank you. That's perfect. Thank you, Siobhan. And it's a pleasure to be here this evening. Tony and myself are no relation whatsoever, as you can probably tell by how much more hair he has than I do. But nonetheless, it's good to have two people called Young, both providing full endorsement of this clinical entrepreneur program. And I'm equally delighted that Northern Ireland's in a position to participate in it for the second time this year. Next slide, please. Research and innovation is a core function within health and social care. That's something to which all senior leaders sign up. It helps us to address specific patient population needs, facilitates early access to cutting-edge treatments, attracts, develops, and helps us to retain the best staff, of which I'm sure we have many attending this webinar, and directly and indirectly, it helps to benefit the economy, something which is a positive benefit, because what's good for the economy of Northern Ireland is good for the health of our population, and similarly, what's good for the health of the population benefits the economy. Next slide. We have a strategy for research and better health and social care, and we're around halfway through the implementation phase of this, albeit having taken a little bit of a sideways turn during the period of COVID, but it describes the general principles that we use to encourage support for research and innovation within the health and social care system. Next slide. We have research infrastructure, which is in position across all 5 trusts in Northern Ireland and also the Ambulance Trust. Cancer Trials Network, a clinical trials unit, research methodology hub, our clinical research network and clinical research facility, all of which are available to those who want to do research. And we've been very keen to put in place similar support for those who want to engage in innovative entrepreneurial work. Next slide, please. Innovation occurs naturally within health and social care, and it occurs in all parts of health and social care. And I'm just going to highlight 2 or 3 examples which illustrate, I think, the diversity of what we do. Next slide, please. Right across the full range of staff, from medical and dental staff through to admin and management, everyone can contribute to innovation that will improve patient pathways and outcomes within our system, or in some cases through establishing spin-out companies and being more openly and obviously entrepreneurial as opposed to intrapreneurial, as Tony put it. Next slide, please. So a couple of examples of really successful developments within Belfast Trust in the virology lab, colleagues working with patients with suspected meningitis recognized the need for a rapid diagnostic test that could be used at point of care level and would give an indication of the risk of meningitis and potential treatment that might be offered to children. They developed a new technology and a rapid test and showed through research that it could accurately diagnose at an early stage meningitis among children presenting with uncertain conditions to the emergency department. Next slide, please. So there was an unmet clinical need, a solution developed which gave results in less than 20 minutes, and working through the Trust's Innovation Support Office, HSC Innovations, was licensed to Hypergene Diagnostics, who subsequently marketed the product on a global level. Next slide, please. And that was the start of a relationship between staff working in the Trust and in Hypergene, which led to the development of other rapid diagnostics, which used the same model, for example, for group B streptococcus infection. Next slide, please. And next slide. And this made a real difference in terms of maternity and delivery, and has proved to be beneficial and effective and successful in a commercial sense. Next slide, please. Now that's one end of a spectrum, and often when people think about entrepreneurship, they think of diagnostics, they think of devices, but in fact innovation can extend much more widely in our system. And another case study was around the development of clinical procedure packs designed to support the insertion of peripherally inserted central lines. Again, staff identified a problem. The aim was to improve patient experience of living with such lines when they had to be inserted, and to ensure safe and effective practice in the service and provide consistent information for patients when such lines were inserted. Next slide, please. Again, with support, our nursing colleagues working in community nursing in the Northern Trust were able to develop the packs, and they've subsequently been standardized and used throughout the Northern Trust area and now more widely. Next slide, please. Again, in the Northern Trust, colleagues working in pharmacy developed RightMed, an electronic medicines reconciliation software to address the lack of communication that can occur when patients move between home and hospital. They recognize the risk of medication errors and increased risk of adverse events in hospital, and developed the software and have commercialized it through Yara Software, a local company. And again, it's been used in the Northern Trust and now more widely within Northern Ireland. Next slide, please. And I could provide many more examples of successful innovation occurring from all parts of our system. In order to support that, for many years, we've had HSC Innovations, an office based in Belfast Trust, but providing services to all 5 trusts in Northern Ireland, which is there to support those who wish to develop intellectual property. Next slide, please. Innovation is the successful development and exploitation of those ideas, resulting in intellectual property, and HSC Innovations assists with the process of developing ideas into products and can provide a full range of advice in terms of making contacts with companies who may be able to work with innovators to develop their ideas. Next slide, please. And just flick on through. We have a desire to ensure that innovation is at the centre of our activities, that everyone will feel that if they have an idea for how patient care and pathways can be improved, that there's support in our system to help them develop those ideas and deliver them. The clinical entrepreneurship has been fantastically successful in Northern Ireland in its first year, as we're going to hear from a couple of our local entrepreneurs. And I strongly encourage everyone to consider applying for this round, and let's ensure that the strong entrepreneurial history which characterises Northern Ireland in all areas of its economy can be further supported in terms of health and social care. And I'll look forward this time next year to hearing more success stories from those of you who are going to embark on the journey now. Thank you very much.
Thank you so much, Ian. That was a lovely presentation and sets us up nicely for our first presentation, brief presentation by one of this year's clinical entrepreneurs, Dr. Frances Duffy, who is a senior clinical psychologist in the Northern Trust. Over to you, Frances.
Thanks, Siobhan. Can I just check that you can hear me and see my screen, because I can no longer see anybody when I'm sharing. So can you hear me okay and see my screen?
Yeah.
Great, okay. Thanks, Siobhan. So my name's Frances Duffy. I'm a consultant clinical psychologist for older people in the Northern Health and Social Care Trust. And I'm one of the first cohort of clinical entrepreneurs in Northern Ireland. So it's great to kind of just come and have a brief chat with you today about what I've done. And what I was asked to do was give just a very brief overview of what my innovation is, and then also my experience on the programme. So I suppose how it started was that I had noticed like challenges that were experienced by our services. And then I really wanted to explore how could we do things more efficiently. So that's really how the innovation actually started. And I think I'd actually say from the outset that collaboration has been essential throughout this process. So I work with people who are living with dementia, either living at home, in care homes, or they're in the inpatient setting. And what tends to happen is, as the person's dementia progresses, they can sometimes engage in behaviours that carers and care staff find difficult to understand and manage. And this can lead to a breakdown in placement, increased distress for everybody, and admission to hospital. And in collaboration with working with care home staff over a number of years, I developed Clear Dementia Care. I'm not going to go into any of the details of what Clear Dementia Care does, but what I'm going to do is I'm going to share with you some of the outcomes of Clear Dementia Care. So in terms of implementation, what we noticed was that in the first year, we had an increase in clinical efficiency. So we had over 50% reduction in face-to-face contacts and the length of the clinical episode. Our waiting times had reduced. We looked at cost savings in the first year of implementation of the model, and they were £100,000. More importantly as well was that the person's placement was maintained. That meant if they were in a care home, they were able to stay in that care home. If they were living at home, they were able to live at home. And we had reduced hospital admissions, and we haven't calculated yet what the cost savings were of those hospital admissions. And then also the clinical effectiveness, so reduced distress and improved quality of life for the person with dementia. So we had really great outcomes, which we were delighted about. And we shared these outcomes. So we published them, we shared them at conferences, and that led to regional commissioning of training for the model. So we rolled out training across the whole of Northern Ireland, and then again through word of mouth and outcomes, training's being commissioned by other organisations, including the NHS and the voluntary sector. So as we gained in success, so I suppose I had never set out to be a clinical entrepreneur. I had just set out to improve the experience of our service users in the Northern Trust. And then other people were kind of interested in our outcomes because the outcomes were kind of so good. So this was something that kind of evolved naturally. It wasn't really something that I suppose had necessarily planned. We then subsequently developed the Clear Dementia Care app, and the app is free to download from the App Store and from Google Play. And to date, the app has been downloaded in 178 countries. We've had extremely positive feedback from carers, from care staff, voluntary organisations and clinical staff. And our care homes in Northern Ireland, and I know in other places in the UK, are actually using the app as part of their induction for new care home staff. And other countries have approached us to explore translation, and we're looking at funding to facilitate this at present. We've also developed 2 books, which we actually give out free across our trust for staff and care homes, or for people living at home. And each of these books has got like 100 illustrations that show the perspective of the person with dementia, with unhelpful responses that actually increase distress and helpful responses that reduce distress. We've produced 8 animations that are on the Trust website, which I'll show you at the end. Again, these are to help carers and care staff to better understand dementia. We've developed, as interests progress, we've developed 4 training programs for carers and care staff, for healthcare staff, and then for staff who'll actually use the full model to assess behaviour and develop appropriate interventions. And in the last 2 years, we've developed a train the trainer programme so that organisations can be independent and they can then deliver training within their organisations. And all of our training is supported by the app and all of the other resources. So we've developed a load of resources that go hand in hand with the training, which includes a handbook and implementation and a suite of paperwork to help people actually implement the model that they're using. So what's the next step? So really, like capacity or demand really outstrips capacity at the moment. So I need to develop an e-learning platform. And this is really, I suppose, where the Clinical Entrepreneur Programme has really been like a godsend for me, I suppose, really. It's just come along at the right time. So I suppose when I'm thinking about other people and what I've learned and what I've gained from the programme is that I've had access to learning support from a range of experts in the NHS and in business, and access to mentoring and support from fellow entrepreneurs. And the generosity of sharing has really just been incredible. That we have monthly pit stops where, you know, I try to go along in person as often as I can over to a variety of different places in England to meet with fellow entrepreneurs. And it's just great building up that network of people that can kind of offer support. Tony, who you've heard speaking, has been, again, you know, real support and just suggesting things like people that you could contact who may be working in similar fields. So I think that's been one of kind of the advantage to me. And I think one of the things that that I've realised since joining the programme is kind of, you don't know what you don't know. And there was loads of things that I didn't really know that I needed to know. And from the meeting other people and the training programme that we have, it's really helped me to build up you know, experience of the kind of things that I need in order to take this forward to the next step. So I suppose just for anybody, like challenge time. Time's always a challenge, no matter what you do. So I think one of the things I struggle with is really finding time to take this to the next step. So I've got, you know, lots of thinking to do about how I can kind of manage that. But I think for anybody with anything you do, I think, you know, time's always going to be a challenge. But if something's important to you, you always find the time to do that. And I suppose the benefits of the Clinical Entrepreneur Programme for me have been like business. Like I'm a clinical psychologist. I know nothing about business, but there's been really some of the people who've come in to talk to us have given us some ideas about business and about, you know, where we can go for the expertise that we need. Also insights into team roles. You know, if you're setting up a team to take this forward, who do you need in your team? What are your strengths as the team player? And then what are your weaknesses or areas really that you don't know a lot about, and who do you need in to support you? Things like, you know, pitching your idea, branding, digital skills, social media, all of these things that I wouldn't have necessarily thought about as a psychologist. And then also ideas about funding. And how do you go about getting the funding for me then, like to develop that e-learning platform that I need in order to take this to the next level? And again, I suppose the list really is endless. So I suppose just in summary, what I think for me, the biggest benefit of the Clinical Entrepreneur Programme is I think it helps you to understand what you need to do to scale your innovation, which was something I say that I hadn't really thought about at the start of my journey. It also helps you to think about the type of people that you might need to help you to do that. But also, and I think more importantly, is that it helps you to identify the right people to help by making, you know, introductions to people who will have information that you don't have. And that's one of the benefits I found that's been kind of really helpful. So I suppose really in summary, I would say absolutely apply for the programme. You won't regret it. And so far, I've had an amazing journey. So that's, sorry, just to say thanks as well. I've had a lot of help along the way, just in development so far where I've gone. So obviously my own trust, the Northern Health and Social Care Trust, the Northern Ireland Executive Office, the Department of Health Northern Ireland, HSC Innovations, and more recently then InvestNI and Harani have really supported me a lot in this journey. So I need to say thanks to them for their support. I will be hanging around a little bit, so if there's any questions, please feel free to contact me directly, or there's more information about what I do in the Trust website, or you can follow me on Twitter. And I know that was a brief whistle-stop tour and I've rushed through that, but that's the end of my talk, and I'm just going to try and see if I can stop sharing. Okay, thank you.
Thanks very much indeed. That's brilliant, Frances. And we'll come back to you at the end with questions, if that's okay. Unless, Tony, do you think that's okay, or do you want to ask questions now? We'll leave
No,
it.
I think let's bring them all together at the end.
That's grand. And now, without further ado, I'd like you to introduce you to a second clinical entrepreneur from this year's cohort, Sinead Welch, who will talk to you all about her journey within the programme and her innovation. And over to you, Sinead.
Good evening, everyone. I'm delighted to be here from sunny rural Northern Ireland. I've got some cows out the window. I don't know which part the rest of you are from, but it's a beautiful evening. I'm just going to ask Erin to please pop up my slides, if that's okay. Would that be all right? Brilliant. So yes, I'm Sinead Welch, a mum of three, aged 9, 5 and 4, very busy. At home, never mind at work, and I am an international child protection specialist. So I'm social work trained, and I spent 10 years of my career living and working in Australia, in Melbourne, fabulous, for the Australian government for 10 years, as I say. Whilst there I was case conference chair lady, court officer, family law court liaison advisor, and I worked alongside Victoria Police during the establishment of the child sexual assault and the family violence investigation teams. I'm a citizen of both countries actually, Australia and the UK, which is great. And if you want any further information, feel free to follow me as well on LinkedIn, and I'm on Twitter. And I'm not going to delve too much deeply into the app, but I am going to provide on the next slide a quick QR code or link there. If you want to just have a look at a later point, you can download the app and squiz at it yourself. So if we could move to the next one, yeah, that's just a real quick code if anybody wants to grab that, or we can get that at the end if you'd like. And then the next slide, please. So again, why did I turn from a social worker into a woman in tech or a digital health space? basically working frontline, especially with children and abuse cases, and we're working with, domestic violence, we're working with addictions and mental health and everything else intertwined with societal issues and problems, all around through your stress issues, self-harm and suicide. So from a professional capacity, I had an understanding of the real stressors for the health and social care sector, because I was frontline for so long. I also did practice here in Northern Ireland as well, in the Western Trust. So I was down in Enniskillen. So that was really important to have a professional basis around an understanding of stress and self-harm and suicide. But it actually was a personal incident that led to the creation of my app that's called Informed Minds. And it was someone we loved, age 21, made an attempt to end his own life. And that was a catalyst that led me to go, right, I'm going to roll up my sleeves, bring my international experience back to Northern Ireland. I came back to Northern Ireland actually because I was pregnant with baby number 3. So everyone wonders, why did you come back? So I'm back home now, nearly 5 years. And we got to work on the app very quickly after that incident. Why did we pick an app? We did some in-house research, and then we got some research from Queen's as well. So I wanted to know, how can digital help support mental health in a preventative way? I was in networks and groups all over the UK and Ireland and Northern Ireland. And to be honest, the Clinical Entrepreneur Programme is hands down the best business decision I have made in 2022, and I will explain why. It's lovely to have networks, but you need the professional leading experts in their field. And for me, it's obviously the field of tech and mental health and social work that have already gained success. But the actual magic for me is they're lovely, humble, approachable, generous professionals in their own right as well. So that for me just took my learning and value of this program to another level. So we need to collaborate. We know that we've got different cohorts and different services across our countries, and I think coming together, this is what I feel the Clinical Entrepreneur Programme is trying to do, to integrate us as the frontline staff or the innovators as well, to try to see how on earth can we help support our national health system, which is obviously our individuals and their families, communities, and then the general population. So I have a big dream. I do know that suicide is a global public health issue, and I want to be able to use my app and my experience and all my connections from the Clinical Entrepreneur Programme to support me to do that, because I cannot do it on my own. Okay, so you need that support around you, and you need the expertise. And I always say, if you think you're the smartest person in the room, you need to get a new room. So if you don't like learning, the Clinical Entrepreneur Programme is probably not for you at all. But if you're open to that and you're okay with people asking you questions that are going to get you to think and reflect upon where your business is at, or maybe you should pivot or change, then absolutely the Clinical Entrepreneur Programme is where you should be. Could we please go to the next slide? So we have been busy. So we've written a pre-publication on how early intervention saves lives, and in 2022 we've had 5,300 licenses paid for across these sectors. So private companies, universities and further education colleges in Northern Ireland and Republic of Ireland. And it's my contacts in the Clinical Entrepreneur Programme that is opening up new connections, warm introduction leads, which are like gold, into other universities. So I'm able to get in front of the student wellbeing leads because I'm getting a warm introduction from a really reputable, whether it's a leader in the Clinical Entrepreneur Programme or one of the speakers that comes on, or one of my colleagues on there. So it's about seeing an opportunity and just gently reaching out for that virtual cuppa. I'm doing a lot virtual because I haven't been able to go to many, but in person, but it's really important to take that bit of action and not be afraid to reach out, because everyone really is supportive, and if they can't meet you, they'll be honest. So it's a no-brainer. We also have the app in one of the GP federations of Northern Ireland, where there's 26 surgeries, so we want to be able to extend that, and I found understanding the policies and procedures associated with the national health system, my goodness, even to just get a taster of an understanding of that was significant to me, because I genuinely didn't know a lot of the things that I was learning from other clinical entrepreneurs around that. So even just to know to be a regulated digital health app and getting that proper review, etc., really helped me to know what to do next and who to contact, and that was invaluable to me as well. The next slide is just a testimonial video. So I was taught, ask your customers, ask your patients, ask your app users what they think. So in true clinical entrepreneur style, I did, and this is a video of it. So it's only like 2 minutes, so please enjoy. But I can't hear that, Erin. Can everybody else hear it?
No.
Don't worry.
Oh, sorry, is there no sound available for anybody? No.
Well, I can't hear it, Erin. I'm sorry. I'm not sure.
Erin, no, can't hear it, no.
Oh, sorry. There's volume on my computer, but there doesn't seem to be. There mustn't be volume on.
Don't worry at all. We'll go past. I'll explain. Most of the testimonials are from people that feature in the app, and basically they're saying it's real ease of navigation, it's an attractive app, really easy to use, and they love the video content. So I'm not going to bore you with all the details of the app. As I say, you can have a wee look on the Apple and Google Play stores later, but it's really important that you ask your patients and your customers, and that was the key point in that message. So the next slide, please, Erin, if that's okay.
Sorry, 2 seconds. This just seems to be a wee bit. Oh, sorry, this seems to be a wee bit frozen here. I'm just going to unshare this and I'll be back to you in a wee second.
No problem. Well, look, I'm going to just explain in relation to the next slide that's going to come up is about why. Why should you come on to the programme? And I'm not sure if it was mentioned earlier, but it's funded, so we don't have to pay to come on to it, which for me was great. I was delighted to be able to come on a 1 year placement, which was funded, and thank goodness mine was funded by Invest NI, so that's all of the Northern Ireland businesses. It's just a slide prior to that, I think. Oh no, that's perfect. That's perfect. The next one is challenges. You're right. Sorry, Erin. So we'll move to challenges. So funding was an issue with regards setting up a business, and I was able very happily to say that I've got some really good feedback from some of my applications that I've put in. I've applied for many grants and lots of time got no thank you, not yet. And that's going to happen. It doesn't mean, that we're failing. It just means you want to build up that little bit of resilience, because you're going to hear no a lot, and the clinical entrepreneur program with regards to the mindset element is second to none. We have Emilios, he comes on at the start of the sessions, the pit stop sessions, and actually just stops and talks to us about these things. Do you know what I mean? So they understand it's a tough time, it's a difficult place to be in, and stress can creep up. So if you get knocked back, just keep trying. If things aren't working, don't give up. So the funding was really important for me, and I'll talk a bit more about that in a minute. And then timing, my goodness, 3 kids, a business, I do some independent assessments still, so it can be difficult. So just be aware of that from the start, and hopefully you'll be able to manage like I have. And I think participation, if you sign up for it, jump all in, because if you come in half-hearted, you'll only get sort of a half of the rewards back, The next slide, please, Erin. So yes, it's funded. I was going to say that. So we're not out any money as clinical entrepreneurs. We just get all the value and we give our time to learn. I wanted, and I used this to develop my commercial skills. So how can I grow and scale my business and my app, not just in Northern Ireland, not just in Ireland, England, Scotland and Wales, but also in Australia. And I'm looking at that as well. So I'm getting lots of links and networks in that space. As I said earlier, I wanted to know more about the NHS policies and procedures, because that was an area, a gap in my knowledge. I wanted to then test and see how could my app potentially benefit the patients, but I wanted it to benefit the staff who are working with the patients as well. And ultimately, I need to be doing something that's purposeful. So it had to be a tech for good, tech for social good as well. We've all talked about the networking. I honestly can tell you that's where the magic happens. If you reach out, pencil in a coffee, a small meeting, it could only maybe be 20 minutes, but at least if you're prepared and maybe a few questions, you'll get some really good action points that you can take away and go and do it yourself. Now they're not going to do it for you. That's the other thing as well. You know, it is going to be your idea and your business to sort of take forward, but certainly the guidance and support is all along the way. The training is excellent, like I've mentioned. Meeting the other founders was just brilliant. That's the first part of all of our training. I've been given an opportunity as an entrepreneur to present at one of the other doctors' events, which was lovely. He invited me along. I raised my hand along with 10 other of the businesses to pitch to the IBM panel, and as a result of that then got some additional mentoring, and I'm going to be delivering a psychological wellbeing program to their early professionals, just all as a result of the clinical entrepreneur. So, you know, it really does hold a lot of weight and a lot of credibility to say that, you know, you are a clinical entrepreneur. For me, I'm at the stage to get investor ready. You may not be, don't panic. It doesn't matter what stage of your business you're at, but for me, it's now time to sort of look at scaling, and my mentor is exceptional, Matt, and I also have a really good advisor, Simon, and then amongst all the other contacts that I have made, we're looking now at getting investment from an investor in Australia. So watch this space. Next slide, please. So this is another snapshot of the benefits. We've got your one-on-one mentoring, which is specific to you, which is exactly what you'll need. Some of the other clinical entrepreneurs are now going to feature in my app, doing their own little videos around health and mental health and wellbeing. Harani have been brilliant. Again, I've been following their newsletter, of course, and I've been getting information on the grants, the invest open calls for competitions and different bits and pieces there that I can apply for money. We're looking at moving into the artificial intelligence space now next with our app. So again, I got really good news of late that we're successful in 50k, just shy of 50k funding from Innovate UK. So we're going to use that to bring sort of artificial intelligence and move our app to the next phase. So we're going to sort out the letter of offer for that in due course, but without the recommendation, or I suppose the power behind the clinical entrepreneur, I've filled out loads of forms before, but it was because I was able to be using a really reputable tech company based and leading in England that really gave us a lovely high score in that section where we had been a little bit weak in prior. So even to know that has given me sort of a little bit of a better understanding as to what they want in these forms, and that's what you want, okay? A bit of guidance on that. And I mentioned the psych program with IBM, and the next slide, Erin, please, is just the quote that I've said. Joining and fully participating is the key in the clinical entrepreneur program was the best business decision I made in 2022. I feel more confident. I feel far more knowledgeable. I've still so much to learn, but now I've got a network that I can go to and tap into as and when I need it as the business progresses. So that's gold dust in itself. And then again, I just wanted to say a little thank you to, I suppose, Tony and Tamsin and all of the clinical entrepreneur leads and everyone that has spoken. It has been absolutely amazing for me. And you can put it on your LinkedIn profile. And it's really got a nice stamp of honour to go up there too. So I think it's nice to share that as well. And as I say, Invest Northern Ireland funded our place, and Harani has supported us all along. And we are friends. We actually have a laugh. There's only 7 of us in Northern Ireland, so you know what I mean. We do have a bit of fun, and you know that's the important bit. So thank you very much. I know I rushed through that, but you know it's after 6. I'm sure you are getting tired and hungry.
Great. Thanks. Bottle that enthusiasm, Sinead. That's brilliant. And we're now going to move on to 2 very brief presentations you'll be glad to hear, and then we're open to questions. So I'll now hand you over to Cheryl Wallace from Invest in I, who has kindly come along tonight to explain how Invest in I can assist. Over to you, Cheryl.
Thank you. Good evening, everybody. Thanks to Francis and Sinead for providing their very real experience at CEP programme. I think they've sold it to everybody, but so encouraging and inspiring, and we value your time, energy, and enthusiasm this evening. So yes, thanks, Siobhan. Good evening, everybody. My name is Cheryl Wallace. I'm a client executive and also sector lead within a life and health sciences team in Invest NI. So Pleased to be alongside you guys this evening, and also pleased to also confirm financial support and software support for the NHS Clinical Entrepreneurship Programme for the next 3 years. We've built up, as Sinead was saying, we've built up a really sort of strong partnership with Anglia Ruskin and also Harani to establish the programme, and very much looking forward to the next 3 years and the exciting innovative services and products that will bring to Invest in, or to Northern Ireland and to the overall ecosystem. The NHS CEP is very much viewed as a pivotal programme within Invest NI, and especially obviously life and health sciences sector, but we do see sort of more services and products potentially going into other areas, including cyber and AI, which have previously been mentioned. So we're very supportive, as well as attracting everyone investment and assisting local companies. Invest NI, our aim is to grow innovation within the economy and support innovation through programs like this, and ultimately with life and health sciences improve patient lives, for which was mentioned previously that it's a win-win for both economy and health. And in relation to the city deals, city and growth deals, you may be aware there's 1.3 billion investment going in as part of the Levelling Up for Northern Ireland, of which there are 4 innovation projects earmarked for life and health sciences. So a significant part of government investment and focus going forward, life and health sciences, will focus on sort of digital healthcare, precision medicine, and One Health innovation in digital. So you're in a really exciting sector, and there's plenty of investment going forward in terms of how we hope to grow the ecosystem here in Northern Ireland, and also capitalise on the sort of centres of excellence that are already established here. Next slide, please, Erin. So in general terms, a wee bit of signposting to our NI Business Info website. It's there's loads on it, as maybe some others will be able to testify. I'm happy to signpost if anybody wishes to contact me separately, you can, but a great website that sort of can link you into other support available for entrepreneurs who are wishing to explore a business idea. We would encourage you to consider the NHS Clinical Entrepreneurship Programme, consider the Pit Stop event, which is happening 13th and 14th of October. But really, you can access a lot of support and advice through Invest NI. We also can offer sort of advice through our technical advisory team for IP, copyrights and trademarks, etc. Or as Sinead said earlier, we can help to signpost you to potentially other funders, for example, Innovate UK across the water or nationally. So that's very important. So as you journey on the NHS Clinical Entrepreneurship Programme, you'll be linking directly into the Life and Health Sciences team and Invest NI, and we look forward to meeting with you and helping you to scale your business as you go forward. So just the last slide for me, Erin. So just some dates for your diary. So on the 10th and 17th of October, there's another couple of events which Tony will be promoting through the NHS Clinical Entrepreneurship Twitter page and LinkedIn, etc. So come along, find out more. And as I say, feel free to get in touch with Invest NI myself personally if you have any other questions. But we look forward to lots of applications and yeah, some exciting projects going forward. Thank you, everybody.
Thank you, Cheryl and Erin. If you would I put the next thank you. That's me, Siobhan McGrath, Chief Operations Manager for the Health Innovation Research Alliance, Northern Ireland. Next slide, and only slide, you'll be glad to know. So this is some practical information for you. For those who are wanting to apply, is to let you know that for this coming year, applications are open on the 3rd of October. They close on the 30th of October. It's all done on a portal. If you go to the links on the website, which you see further up, you will be able to find out how technically to apply. The programme starts in February next year, and you will know if you're successful approximately mid-September to January. And your innovation, it's all about innovation. Your innovation in your application, explain what your innovation is, how it is beneficial to the health service in some way. And you are welcome to apply even if you're